Hey, what's up YouTube? So I'm back. It's been a minute. By a minute I mean like a million minutes, because I don't think I've posted since sometime in the beginning of the semester. It's August 17th today. It had to be like June. So it's been a minute. Nursing school update is what this video is. I'm gonna go ahead and take this off because it has my government name on there. But let's see. So today I'm wearing my scrubs. We had our final like OSCE skills evaluation thing. So yeah, I guess I'll tell you all about today, and then I'll just recap semester, because I know I didn't update at the very beginning after orientation, and then I don't even remember what I did. Did I do a halfway update? Don't remember. I think I might have. So whatever, this is the end of semester 1 level 1 update, official. Yeah, so today we had OSCE. I don't know what OSCE stands for. You have to Google it if you want to know. I personally don't care to know. I'm done with it for the semester and I'm ecstatic. So let's see. Today we actually had our first like final OSCE last week for our like health promotions and core classes. Today it was for farm. So today all we had to do was give some meds. So the way they did it, they gave us 4 meds. We had to find out which ones. We ended up not find out, you had to prepare your drug cards and things for all of those possible drugs. And then when we get there, based on the scenario, you're able to know exactly what drugs you need to give. So we ended up giving 2 of them. I won't like be too specific because they don't change up too much for this semester. It's just in case y'all are going through the program, but you're always going to prepare for a few more than you give, because they don't want to give you exactly what's going to be on there. So that's like the gamble. You do get to prepare, so you get to write down you know, what drugs you need to give, like the information about the drugs that you need to give, but you don't get to know exactly which ones you're actually going to have to give. So you have to prepare the information for all of them. You get a brief like S-bar or like a, I don't know, just lets you know what the thing's gonna be about. But yeah, it's not enough information for you to know right then and there, oh, I can't give this med because it's contraindicated. So really cool. It only took 20 minutes. So you sit, you wait, you go to your scheduled time, they call you back, you do your thing, and yeah, our grades should be posted by the end of today. We did do a practice one. On the practice one I made a 90. I felt pretty good about this one today, except for just, yeah, I forgot my cards at home, had to run back. Ended up making me like a little bit late to be early. So like my scheduled time was 3:20, so I was supposed to be there by 3. I would have been there by like 2:45, but then I forgot my cards at the most horrible area that I could have, to where it took me a minute to circle back around to my apartment and grab them, and then I had to go back to school. So I ended up like walking in the doors right at 3, and they were running early, and it just gave me anxiety, but I do feel like I still did awesome. So let's see, at this point in the semester, like I said, it's August 17th. We have already taken, I did 4 classes this semester, if you didn't know. We've already taken 2 of our finals. They're done. Those 2 finals were written by like our faculty of our program at my school. So we have 2 finals left, and they're actually written by ATI, so they're the harder finals. And let's see, our teachers really don't know much about them, so all we can do is study. ATI is just like a software that creates, I don't know, just material. So if you ever took the TEAS test, you took it through ATI, you know, they have those study guides for everything, and just, we have a bunch of books for each of our classes that are made by ATI, and they're really expensive. And just, ATI is just, it's formulated in like NCLEX ways, so that all the learning material, the tests, everything is supposed to be building us up to pass NCLEX when the time comes. So awesome thing. Last Saturday, the summer people who are in their 4th semester, level 4 students graduated. So I have literally 1 year to graduate. Actually, like, what, 51 weeks now? Or almost 51 weeks, because that was, today's Thursday and that was on Friday, I think they graduated. So, but our graduation is the same day next year, 2018. Super exciting, so close, yet so far. But throughout the semester, I did pretty well, I think. I was aiming for like all A's, like if I could. I think I'm gonna end up with either 2 B's and 2 A's or 3 B's and 2 A's. And yeah, honestly, hard work. I don't know, it's doable. I think there were definitely a few, if I could have tried a little harder on certain things and gotten A's in a couple of the other classes, but like for pharmacology, I am probably gonna come out with an A in that, like a low A, like a 90, but still, even if I end up with an 88, just, it's hard. It's really hard. So, I don't know. So this semester, 4 classes. We took pharm, so that's pretty much just my brief summary of pharm. I don't want this video to be too long, but if you guys want information about how I studied for pharm, I can definitely like make a separate video on that. So just let me know in the comments, because it took me a second to find exactly what worked for me, but it worked. All of my test grades, I don't think I scored lower than an 86. Except in the last test, which I did not study. I had to move my 24 hours to move my stuff. Not really an excuse, but we had 6 exams, so it was the very last test, and my exam average was an 88, so I knew I had that room, so I just really didn't have time or motivation to try to study, and so I just did the bare minimum, and I didn't do so high, but it only brought my exam average down to 84. So kind of maybe a smart tip, just do your best so that one day if something happens and you're just not able to, then you have room. I had a cushion, so still probably gonna get an A. But yeah, if you want more information about that, comment below, let me know. So we took pharm, we also took core concepts of nursing. So that is exactly what it sounds like. It was literally about the core concepts of nursing. So it was a lot of, wash your hands, therapeutic communication, learning how to essentially think like a nurse. So not a lot, but we would get those test questions where it's like, you have a patient with shortness of breath, you have a patient who's complaining of pain, you have a patient who is, I don't know, crying. Which one do you assess first? And it would be the patient with shortness of breath, because that's a little more life-threatening. But of course it wouldn't be that easy. Some of them would be kind of close, because you're like, it might say a patient on warfarin who is bleeding. And warfarin's a blood thinner, so they're not gonna clot. Like, it wouldn't be that simple. So you had to know, because it always seemed like 2 of the answers most of the time seemed like completely like absolutely not, but there's 2 answers that you're like, I'm just gonna close my eyes and click on because they both sound amazing. So core concepts of nursing, pretty simple. I mean, I honestly didn't study too much there. I didn't miss a single day of school this whole summer, which is awesome. But for me, just hearing the information, I either got it or I didn't. There isn't, that's the thing. For the only class where you could memorize was pharmacology, because you had to memorize, certain symptoms and contraindications of certain drugs, and just certain times where you wouldn't be allowed to use them, or when you should, or when you want to use caution. So you did it, that was straight memorizing. You either memorize it, of course, understanding it did help, but memorization was the main part, versus all of our other courses, it's about thinking like a nurse. So you either kind of get that thought process or you don't. So for me, it kind of came easily. I would always look at reviews. Like people from the upper levels, our friends and things, mentors would send us the review, and we just add on to it, make it our own. I'd sometimes just pull it up on my computer and hand write it out and add whatever I needed to from the book and my notes. That way, just writing it. So I typically look over the review once, maybe twice, reading it, maybe make some notes on the side, and take the test, and I did fine personally. However, I know some people, that thought process didn't come as easy for them, so they did have to just, I don't know how they studied for that, but it's really, there's nothing to memorize. There's a few things, like you would have to memorize, you know, like a normal heart rate is, what, 60 to 100? So you'd have to memorize that, because the question could say, you know, I don't know, like the one I just said, and one of them, it could give you that, like their heart rate is 120. So you'd kind of want to go check them out, maybe that could be the answer. But if you didn't know that that was out of the norm, then you wouldn't know to make that answer. So, but for the most part, it was purely conceptual. So you either understood it, like some of the questions I've read them and I'm like, wow, if like just the way I think, I look at the question, if it asks for an intervention, which is something that I would do, like raise the head of the bed or lock the wheels, something that I could actually do, then in an answer said something like, I don't know, just a not intervention, like a fact, like elderly and or immunocompromised patients are more at risk for infection. That's not an intervention. So me personally, I'm crossing that out, versus some people would, I don't know, just think differently. But there were a lot of questions that I would look, and just the way I would rationalize them out, because before I even start needing to apply specific knowledge that I have, I'll narrow down an answer like that. That's not an intervention. The question asks me for an intervention. That can't be the answer. It's just a random fact. So yeah, that's true. Immunocompromised people are more at risk for developing all kinds of diseases and things. But that doesn't, they didn't ask you that. So I don't know. Forgot my point, but yeah. Some of the questions, oh, that's what I'm saying. There was really nothing you could memorize, because without any prior knowledge to nursing, I could literally answer everyone's fault. They'd be like, okay, cool. Like you could just kind of rationalize it out without knowing there might be a disease thrown in there that I have no idea what that is yet, because we pretty much level 1 is about learning the norms, kind of learning how to do things, but we're not learning exactly when to do them yet specifically. Like we know a few, like we know how to listen for the, yeah, that wasn't a good description, but we learned how in our assessment to listen to each spot on the like lungs and the heart, but we don't know, okay, this is, we know a few, but we don't know specifically, like this is crockles, this is like for breath sounds. So we just learned how to do it. We didn't learn specifically like what we're listening for, like, well, I mean, you know what you're listening for, a breath, but for abnormalities, we're just learning like the norms. We're not focusing on children, we're focusing on a normal adult patient. So there's some stuff that you can just kind of rationalize it out without even having too much information about what the question was saying. So I didn't struggle with that. Health promotion is the same way. It's called health promotion across the lifespan. It's literally about promoting health across the lifespan. So you literally learn how to, the goal is, you know, health promotion and prevention versus having to, you know, treat a disease. So, you know, like we're learning about immunizations and how to prevent, you know, certain things, like, you know, you do your breast exams and you can do like your testicular exams, things like that, because you want to just promote health. So we do still talk about a little bit of treatment in that course, but the main focus was just learning those different ways that you could possibly prevent any like diseases and disorders. Learn the difference between diseases and disorders. We learned about physical activity in that class. We started off with like the religious and spiritual aspect of it. So knowing those certain religions, you know, they won't accept blood products. They won't allow you to put them on like prolonged life. So no life support, no like artificial breathing machines. So we learned that kind of stuff, which is really, really important to know. So our last class was integrated learning. So I'm kind of glad I did it in that order. So integrated learning is also exactly what it sounds like. It's designed to integrate all of our other courses, so health promotion, core, and farm for us this semester. Just put them together in like you know, that way. Because in pharm we're just learning how to, like, what meds do, versus in core a question might, or integrated, the question might say like, it might take like a concept from core, it might take that spirituality aspect from health promotion, and a medication. So like a blood product that counted as a medication. So, you know, would I think it's, we took this final Monday and I kind of just clocked out, but with a person of this religion, they are, you know, going under this whatever procedure, do you think that they would accept blood products? Of course, the question is not like that, but it integrates everything. So yeah, that class, it was our like shortest class. We did our final for that one like 2 weeks ago or so, or over 2 weeks ago, versus our other finals are like now. So yeah, that class, it's all pretty simple. All the lighting has changed, but it's fine. So it's all pretty simple. It's a farm, and there's just certain things that there are a few things for core and health promotion that you just have to memorize. We kind of had to memorize that whole in health promotion you talk about, like I said, it's health promotion across the lifespan. So there's different things you need to know for infants versus toddlers versus preschoolers, school-age children, adolescents. So you have to memorize that that age group. Like obviously an infant is under 1 year old, a toddlers until they're 2, a preschooler is 3 to 6, and so on and so forth. But if you don't know that, and the question's not going to say, and it sometimes might say a preschool age child, but or preschooler age child, whatever. But a lot of times it might just say a person is 6 years old. What's the normal behavior for this? You know, what you call is normal behavior for a child at that, you know, age of development. So if you didn't know, like, okay, a 6-year-old is a preschooler, and be able to lump that to what preschoolers do, then, yeah, you'd be kind of struggling. You know, preschoolers are that thing, I forgot what it's called, but where they only want to eat one food. Like I had a cousin who just wanted to eat mayonnaise sandwiches, and yeah, like bread and mayonnaise. And you know, like you had to know that that was typically like one of the answers, because it alarms parents. You have to let them know, like it's not bad. Just give them that one food. It's short-lived, so you do have to memorize. Okay, so like I said, if you guys want to know specifics about like how I studied, I can do a video on that. But yeah, like I said, this is just an update. The semester is going pretty good. I probably should have watched back my initial video after orientation to answer like questions I had been that I can answer now. But I don't know, just let me know if you guys have any questions. My semester is pretty much over. I have my core final tomorrow, and then I have my ATI farm final on Monday, and then we are done for this semester, and we have a 3-week break. So on this 3-week break, I definitely want to get back kind of on YouTube. I think I'll pre-record a few videos, and I'm just, now I did semester 1, I get it. I don't know, I'll definitely be able to hopefully YouTube more throughout the semester and just, I don't know, not completely lose everything while I'm in the middle of school. So, but I do have this break, so I plan to do a lot of recording. I don't know if I'll post all the videos during the break, or if I'll probably spread them out. But yeah, I'm excited. Definitely please subscribe to my channel, follow me on Instagram, Snapchat. Yeah, thinking about kind of migrating away from Snapchat, but definitely follow me on Instagram. That is honestly what I use the most, my Instagram story, and I post on my Instagram often. So yeah, follow me on Instagram. Comment below, let me know what else you guys want to see. Do you want a study tip video? Do you want a what's in my backpack, or what's in my nursing bag for like clinicals? What, I don't know, maybe my clinical experience, because like I said, this, if you don't know, my program is 4 semesters. First semester, all of our clinicals are strictly in simulation. So I do have some experiences, we work with SPs, so they're like standardized patients. They're like just pretending to be a patient, and so I can do that. So just let me know what's in my bag, what's my nursing bag, maybe a clinical experience, a study video, maybe more frequent updates. I could definitely do that. That might go into more detail. I don't know, any fitness stuff I want to see, anything, even if it's not fitness, not related. I just moved, as you can see. I'm in the process of decorating my room. I can definitely finish and show you guys that. Whatever you want to see, let me know. So subscribe, follow me on Instagram, Snapchat, etc. You can follow me on Twitter, although I don't tweet often. But yeah, thank you guys for watching my channel. Don't be forgetting anything. So you guys have a great day, and I'll see you guys next time. Bye.